Hello, everybody, and welcome back to One Day, One System and Multiple Disease series. So, today, the system that we're going to talk about is the cardiovascular system. Yes, heart, arteries, veins, capillaries, blood vessels. So, we are going to talk about today in this blueprint anatomy, physiology, pathophysiology, the repair mechanisms of heart, the therapeutics, and the surgeries. Right, so we have a lot of coronary angioplasties going that are there, bypass surgeries, heart pumps, heart stems, heart valves that are being artificially, inserted through the surgeries or SA node like the pacemaker. So first of all, heart. Heart is a pumping organ. That is why there's a positive chronotropy, force of contraction, and heart rate, right? Inotropy and chronotropy. It is have connected through the vascular blood vessels, arteries that are deeply situated, and veins which are superficially. That is why whenever you twist you can see the blue color veins, but you cannot see the arteries. And what is the main component? It's the blood. Blood is a fluid liquid connective tissue that is having mesodermal origin, and the blood carries lot of constituents like plasma and the cells, corpuscles. Plasma has inorganic nutrients, electrolytes, multiple things, right? And plasma minus the clotting factors gives you serum, right? So primary function is to deliver oxygen and nutrients, remove the carbon dioxide and metabolic waste, maintains the blood pressure and systemic perfusion, and supports the thermoregulation and the immune transport. So the cardiac architecture, the tricuspid walls are present on the right side between the right atrium and the right ventricle, while the bicuspid walls, also known as the mitral walls, are present between the left atrium and the left ventricle. There are two other walls. One is the semilunar walls and the pulmonary walls. So there are three layers of the heart: the myocardium layer, which is the inner layer; pericardium, which is the covering of the heart; epicardium, which is the outermost layer; and endocardium, which is the innermost layer. And the largest artery is aorta. Arteries carry oxygenated blood away from the heart, except pulmonary artery, and veins carry deoxygenated blood towards the heart, except the pulmonary vein. So the conducting system consists of SA node, AV node, bundle of His, and Purkinje fibers. Sinoatrial node, atrioventricular node, bundle of His, and Purkinje fibers. The physics of circulation is basic. The cardiac output is a multiplication of heart rate and the stroke volume. Heart rate is approximately 60 to 100 beats per minute when measured on the sphygmomanometer or whenever using a diaphragm. Right, on the radial artery, many times you can measure the heart rate, right? The beats. Then the heart rate is 72 beats, stroke volume is 70 ml. Altogether, the cardiac output is 5040 ml, which is 5 liters. The cardiac cycle consists of atrial systole, that is the atrial contraction, ventricular systole, which is a ventricular contraction, and joint diastole, which is a ventricular filling. Okay, that's called joint diastole. So, the systemic regulation, the first regulator is the sympathetic overactivation. The second regulator is the baroreceptors. So, the carotid kinase detects the change in the pressure. And the third is the RAS, renin angiotensin aldosterone system. Aldosterone secretion promotes sodium reabsorption, water reabsorption, and indirectly increases the blood pressure. Most of the times, the diseases related to the heart are arrhythmia, tachyarrhythmia, bradyarrhythmia, Wolff-Parkinson-White syndrome. The other paroxysmal supraventricular tachycardia, right? Paroxysms. So you give magnesium sulfate, lot of agents which are used for the immediate management. Then you have arterio and atherosclerosis, that is the lipid deposition forming foam cells and plaque. And finally, this rupture to form a thrombus and embolus. Then there are severe diseases like the peripheral artery disease, coronary artery diseases, stroke. Stroke doesn't occur because of lack of oxygen. This is the biggest myth. लोगों को लगता है स्ट्रोक इसलिए होता है क्योंकि ब्लड सप्लाई कम हो गया। नहीं, स्ट्रोक का असली मतलब है ब्लड सप्लाई बंद हुआ और सडन ब्लड सप्लाई आया। इस्केमिया रीपरफ्यूजन, IR कहते हैं उसे in the cardio, because my master's was on cardiovascular system. So definitely I always love teaching CVS and CNS. Then we have myocardial infarction. Myocardial infarction is heart failure. There are a lot of cardiotoxicity mechanisms. Number one is drug induced NSAIDs. NSAIDs का सबसे ज़्यादा contractibility होता है thrombus form करने का. Second, apoptosis, when the cardiomyocytes starts dying. Next, contractility of myocardial fibrils. electrophysiology, the different ion channels, sodium channels, calcium channels, potassium channels that are involved in the electrophysiology in the ECG. The next is mitochondrial dysfunction at the molecular mechanism in which the mitochondrial fission, mitochondrial membrane proteins, and the potential is being altered. The other diseases involve angina pectoris, in which there is Prince metal angina that occurs during exercise, that occurs during rest, and stable angina, which occurs during the exercise. So, heart failure is mostly because of increased afterload or increased preload, causing negative remodeling of heart, and that is why that's a major cause of the cardiovascular failure or cardiovascular collapse. Arrhythmia is because of sudden ectopic foci, firing of impulses, triggered activity, or the circus re-entry, that is blocks or re-enters the pathway causing electrical movements. So valvular diseases involving stenosis, stenosis का मतलब होता है narrowing, regurgitation, या तो backflow या तो leakage, congenital heart diseases that involve autism spectrum disease or some VSD, teratology of Fallot, coarctation यानी कि बच्चे के दिल में जब कहते हैं ना होल है, right? That is what is congenital heart disease. Then there is NSTEMI and STEMI, non-ST segment elevated myocardial infarction and ST segment elevated myocardial infarction that are very, very commonly involved. Along with this, you also have the primary and secondary hypertension in which renal endocrine disorders or some drug-induced diseases can occur. Mostly we use the ECG, but if the ECG doesn't work, we use the 3D echocardiography. Along with that, we have advanced imaging techniques like MRI and angiography. If you want to know about the cardiac function test, mostly the ANP, BNP to check the hypertrophy. You have troponin, LDH, CKMB, that is creatine kinase myoglobin, and the lactate dehydrogenase. They are the very common myocardial damage markers. Symptoms and assessment, mostly there's a severe chest pain, dyspnea. Dyspnea is shortness of breath, syncope, chakkar aana and गिर जाना, palpitations, थकान लगना and छाती भारी हो जाना, peripheral edema, पानी जमा हो जाना in the peripheral systems. Antihypertensives are widely used to treat, like we have ACE inhibitors, angiotensin receptor blockers. For vasodilators, you have nitrates. Many times we have sublingual nitrates like nitroglycerine, GTN. Then we have calcium channel blockers, diuretics that are very commonly involved. In the other agents that are involved are beta blockers and the anticoagulants like the antiplatelet agents, clopidogrel, aspirin. Aspirin is ecosprin, very commonly used at 75 mg for the antiplatelet activity. It acts as a plasma thinner, thins the blood. Then percutaneous coronary interventions. सिंपल से बताओ तो एक बलून को एंटर करवाना, वो बलून जैसे ही आपके बॉडी में इंसर्ट होता है वो इन्फ्लेट करेगा तो वो एक्सपांड होगा तो बलून रिमूव हो जाएगा, लीविंग द स्टेंट इन प्लेस. तो स्टेंट आपका वो दोनों आर्टरी को बड़ा कर देगा और बलून आराम से छूट जाएगा. सो दिस इज एन इमेज ऑफ हाउ कभी भी मोस्ट ऑफ द पीपल हु ईट लॉट ऑफ लिपिडिक फूड्स, हाइपरलिपिडेमिया, डिसलिपिडेमिया, दे suffer from plaques. So wire balloon inserted through that, and then the arteries are expanded, and the balloon um, leaving the stent behind. Then you also have the CABG, that is coronary artery bypass graft. So that is also one of the very, very important graft that is involved. And the device therapy like the pacemakers, which corrects the electrical failure. All right, you also have some ICDs like the implantable cardiovascular defibrillators. Defibrillators are very, very commonly used, to and management for the arrhythmia. So either you they like take up non-pharmacological interventions like the exercises, lifestyle management, or pharmacological like the drugs and medications. So leaving cigarettes, alcohol smoking, weight control, performing aerobic exercises, management of diseases like avoiding food, right, and maintaining good goal habits. So this is about the cardiovascular system. I hope that you all have got a clear idea of how your vital engine works, right from the pulmonary to this double circulation, systemic circulation, to the architecture of the heart, how the pumping occurs, fueling occurs, the ECGs, the cardiac output, the pathophysiology, treatment, anatomy, HRAF, that is the heart failure, ejection fraction, right? Pumping problem, HFREF, and HFPEF, that is a filling problem. HFREF is a pumping problem, HFEF तो common रहेगा, ejection fraction. It's just R and P, pumping problem and filling problem. So there are a lot of electrical manifestations that occur, that is enhanced automaticity, spontaneous triggering or firing of the foci, and there's NSTEMI or STEMI, which are being commonly involved. So echocardiography is very commonly used technique in which you can see these kind of parastral images are obtained or apical chamber images. So ion channels, fibrosis, apoptosis, mitochondrial contractility, electrophysiology are some of the factors which affect the cardiovascular system. So you need to manage the preload and the afterload definitely very nicely. So that is it for today's video. Thank you so much for attending the class, and I hope that you all would have got to learn a lot of new things. Stay connected with us for more such upcoming information and videos. Bye bye. Take care, all of you.